Good morning, Sarah. How are you today?
Good morning, John. I'm doing well, thank you. How about you?
I'm good, thank you. I wanted to discuss something with you regarding differentiating between moderate cases and critical ill cases in our clinical practice. It's something I've been thinking about lately.
Absolutely, John. It's an important topic, especially given the complexity of patient cases we encounter. How do you propose we go about differentiating between the two?
Well, I believe it starts with a thorough assessment of the patient's condition and understanding the key indicators that distinguish moderate cases from critical ill cases. For example, in moderate cases, patients may present with stable vital signs and mild symptoms, whereas in critical ill cases, we might observe severe physiological instability and organ dysfunction.
That makes sense. So, would you say that assessing the severity of illness using scoring systems like the Sequential Organ Failure Assessment (SOFA) score or the Acute Physiology and Chronic Health Evaluation (APACHE) score could help us differentiate between the two?
Absolutely. Utilizing validated scoring systems can provide objective data to assess the severity of illness and guide clinical decision-making. However, it's also essential to consider the clinical context and individual patient factors when interpreting these scores.
Agreed. In addition to physiological parameters, we should also consider other factors such as the patient's medical history, comorbidities, and response to treatment. These can help us gauge the overall clinical picture and determine the appropriate level of care.
Exactly. It's about taking a comprehensive approach to patient assessment and using all available resources to make informed clinical judgments. By doing so, we can ensure that patients receive the appropriate level of care tailored to their individual needs.
I couldn't agree more, John. It's about being vigilant, thorough, and collaborative in our approach to patient care. Thank you for initiating this discussion. It's been insightful.
My pleasure, Sarah. I always value our conversations and the opportunity to exchange ideas. If you ever want to continue discussing this topic further or explore other aspects of clinical practice, please don't hesitate to reach out.
Likewise, John. Thank you for your expertise and collaboration. Let's continue working together to provide the best possible care for our patients.
Absolutely. Have a great day, Sarah.
You too, John. Take care.